Have you ever caught yourself in a mental fog, maybe felt bloated or exhausted after finishing a meal, where you even referred to as having the itis? But your doctor reassures you that it's all in your head because of the celiac test results came back negative? Well, as someone who values listening to their body and learning about our bodies through how we nourish and treat ourselves, I personally prioritize my daily contribution of focusing on fitness, health, practicing intermittent fasting, and avoiding dairy and gluten. However, I've still experienced firsthand how gluten sensitivity can seriously affect how the body feels and functions, despite prioritizing my health. Today, I just had gluten pancakes, and yep, my body is already throwing a fit. Who here learns the hard way sometimes? Non-celiac gluten sensitivity, also known as NCGS, is a real circumstance that impacts many human beings and deserves a soaring popularity, even without a professional celiac diagnosis. First, we'll cover effective solutions. We'll also go over the scope and consequences of the problem with gluten. And lastly, we'll explore improved quality of life that these solutions can bring to those with gluten sensitivity once actually applied. So first things first, the actual problem, gluten. So NCGS influences an extraordinary portion of the population. Meta-analysis estimates approximately 6.3% of adults are affected. And NCGS symptoms include bloating, fatigue, headaches, brain fog, anxiety. However, no preferred biomarkers actually exist. And without recognition, people suffer from persistent chronic symptoms and may experience nutritional deficiencies or mental health issues. There is a 2021 systemic review that notates that a gluten-free diet often provides relief, but symptoms are frequently misunderstood or dismissed. So understanding the tremendous impact is the first step to gluten sensitivity. So what should we do about it? Well, solution could be encourage clinical education on NCGS and primarily focus on symptom-based evaluation. We can also promote official guidelines like the Salerno criteria for diagnosing NCGS. We can also even advocate for better labeling and gluten-free alternatives in schools, in restaurants, and even in hospitals or medical settings to give, all of the patients and students, faculty, and everyone a chance to thrive and have options that will benefit them and their health. Another way that we could put this into effect would be include NCGS in continuing education programs for healthcare professionals to educate students. We can launch public health fitness campaigns and webinars, even urge food service vendors to adopt clear gluten-free standards. So, what could life actually look like once people take this seriously? Once they actually prioritize and take NCGS seriously? Well, advantages and benefits of the solutions that I've discussed. Imagine a parent who no longer avoids eating out for fear of sudden bloating, right? Or even having brain fog. countless people would enjoy going out more. They'll have more energy, better digestion, mental clarity with widely available gluten-free options. Healthcare systems would see fewer misdiagnoses and unnecessary treatments, improving the well-being and reducing costs even. So to wrap this up, NCGS influences millions. It's regularly overlooked. However, it can be effectively managed through awareness and dietary strategies. Let's treat gluten sensitivity with the seriousness it merits. Talk with doctors, professionals about NCGS, support better food labeling, and encourage restaurants, schools, and even medical facilities to have better food labeling and provide safe gluten-free choices, because no one should suffer in silence.